Hello, and welcome to our very special show today entitled Protecting Our Kids, the Truth About Immunizations and Vaccines. My name is Dr. Reed Tuckson. I am a co-founder of the Black Coalition Against COVID, which combines medical professionalism and community-based grassroots influencers in Washington, D.C., along with our 4 Black medical schools, Howard, Meharry, Morehouse, Charles Drew, the NMA, the National Black Nurses Association, the Urban League, and blackdoctor.org. As we are all too well aware, the COVID pandemic has extracted a heavy and disproportionate toll on the Black community. For many reasons, we were infected more often, suffered more once infected, and died in tragically higher numbers. Black children were not immune to these disproportionate effects, and unfortunately, between April of 2020 and June of 2021, 1 in every 310 Black children lost a parent or a caregiver, compared to 1 in 738 white children. There's also been a concerning and disproportionate increase in the number of Black families raising children in poverty and who are suffering the effects of financial, housing, and food insecurity, all of which have significant impacts on the well-being of their children. Additionally, Black children's pandemic-related loss of in-person schooling has had significant implications for their educational achievement, socialization, and even their nutritional status. Well, as we will learn during this show, there are other monsters hiding in the closets that are threatening our children's lives and well-being, just waiting their turn to emerge while we have been focused on COVID. And these are the monsters of preventable childhood illnesses. Childhood vaccination rates in the United States have declined compared to pre-pandemic levels, and experts fear that vaccine hesitancy could bring a resurgence of previously controlled diseases. In fact, it's already begun. And we'll talk about those issues in a moment. We all have a stake in preventing these diseases from creeping out of the closets and imperiling our children. And as we will learn, it truly does take a village to protect our children and adolescents. With me today to discuss protecting our kids, the truth about immunizations and vaccines, is a distinguished panel of experts, people who care about children, and experts who care about transmitting accurate, science-based, practical information to our community. Let me welcome and introduce our panelists. And first, Dr. Oliver Brooks, the Chief Medical Officer and former Chief of Pediatric and Adolescent Medicine at the Watts Healthcare Corporation in Los Angeles, California. He's a member of the board and past president of the California Immunization Coalition, chairman of the Immunize LA Families Coalition, and a member of the National Leadership Panel for the Adolescent Immunization Initiative. And I've known him for years when he served as president of the National Medical Association. Dr. Andrew Drew Otu, president, Global Vaccines for Merck Human Health, 20 plus years of experience as a career pharmaceutical professional and executive leader in vaccines. He is committed to scientific rigor in working with others and trusted evidence when communicating with the public. Dr. Latonya Riddle Jones. Dr. Riddle Jones is an assistant professor in the Department of Internal Medicine, the Division of Internal Medicine and Pediatrics at the Wayne State University School of Medicine. She is credentialed in both internal medicine and pediatrics and teaches at the Children's Hospital of Michigan and the Detroit Receiving Hospital in Detroit. And finally, we are very pleased that Deborah Levine has joined us. She is the director of the City of New York's School of Public Health, Harlem Health Initiative, where she has been tireless in her work to address neighborhood service priorities that are designed and have been successful at reducing health disparities throughout Harlem. Well, welcome one and all, and we are excited to engage in this conversation. And so right out the bat, let's set the stage for parents. One of the great things is that we have a lot of vaccines available that work well and work safely to prevent illnesses in children and adolescents. The challenge is there's lots of vaccines that parents have to keep track of. Dr. Brooks, help us to size the dimensions of this opportunity and this challenge. How many of these vaccines are there?
So, and good day to everyone, and great to be on a panel with such distinguished individuals. So there are somewhere around 14 to 17 what we call vaccine preventable diseases. So there's a large number. Fortunately, we can give them in combination so these children don't have to get that many shots for every visit. But the bottom line is the World Health Organization determined that other than safe drinking water, vaccination was the most important public health advance of the 20th century. So these children and adults, I will add, but we're talking about children today, need to get their vaccines. The graphic up here shows births, 1 to 2 months, 4 months, but the vaccines go all the way up to adulthood through 17 years of age. Okay, very good. And this is another, and it even goes from there. So it is critical that our children get vaccinated. They can get illnesses that are fully preventable if they don't. And we've seen it happen. We've seen a recrudescence of whooping cough in California. We saw a measles outbreak from the Disneyland exposure. We've seen pneumococcus, which causes ear infections, more ear infections, pneumonia. So these children need to get their vaccines, and it needs to be clearly understood there are more vaccines other than just COVID.
So as we look at that list, Dr. Brooks, and it is at one level, I think that the key thing that I'm locking in on that you said, and you're reminding us, is that we have this plethora of drugs that work well for children, but there are a lot of them, and you've really shown what a variety. Tell us a little bit about the relationship that you as a health professional, as a pediatrician, has with parents and children through the routine childhood visits that kids should be having. What's the relationship between the vaccine relationships and the routine well-child visits?
Yes, excellent question. So generally speaking, children come in for vaccine at age 2, 4, and 6 months, 9 months, 12 months. So what is happening beyond the vaccines is that as a 2-month-old, I want to make sure that child is developing normally. I want to see if that mother is breastfeeding. I want to make sure that the child has normal growth. At 4 months, I again check development. That child should be rolling over. There should be a relationship. There may be other children in the family. I want to ensure they understand that there's a new child in the family. At 6 months, we see more sitting up. 9 months, starting to walk. 12 months, walking. You're transitioning from breast milk to solid foods. You're checking for lead, checking for anemia. So there are a host of other things that go on at these visits, and the tie-in with the vaccine is perfect because they're getting their vaccination, they're being protected. They're also getting their evaluations, and this goes throughout childhood.
Perfect. Dr. Riddle Jones, one of the great jobs that I had in my life was to be the Commissioner of Public Health in Washington, D.C. And in that capacity, sometimes when the school year would start, I would observe the children coming back to school. And almost always, there was some new tennis shoes that they may have gotten that their parents made sure they had, or some artifact of clothing that was particularly in style. But too many times, I noticed that those very same children were not up to date in their childhood immunizations. Tell us a little bit more, if you would, about why it is so important that as parents, caregivers of children, we make sure that our kids get these immunizations and these vaccinations against preventable illness, just as important, more important, obviously, than whether or not they have the latest brand of tennis shoes.
Oh, absolutely. So thank you for that question. As Dr. Brooks was just mentioning, there's immunization schedules that go along with well-child visits. And it's so important to stick to those schedules as much as you possibly can because there are combination vaccinations that can be given. Anytime you're off schedule, then it's an opportunity for us to vaccinate as long as you're coming in, but then we may miss the opportunity to give one of those combined vaccines. And every time a child gets immunized, it's the equivalent of having a traumatic event. So it's just really important to try to stick to that schedule. If you have questions about the schedule, please ask your medical provider. Any questions you have, we're happy to answer them. But we also have you brought up, Dr. Brooks brought up whooping cough, which is a vaccine preventable vaccine or illness. And then we also have influenza. And so anytime a child actually acquires the actual virus, so say a child gets influenza or gets the flu, then you actually can see delays in developmental milestones. So every single vaccine that we have listed here is so important. And we're also hearing about the resurgence of polio in New York City. And so anytime we pick up on one case, we know that there are likely hundreds of cases circulating in the community. And so every time there's someone who has a vaccine preventable illness, those who are not able to get the vaccines, they are at higher risk for attaining that illness as well. So
I want to make sure that everyone in our audience heard what you just said about polio. Now, this is hard to imagine. This is a disease that we had cured, that we had conquered, and we conquered it through having the population immunized against it. And you're saying now that polio is starting to be noticed in a city as modern as New York City in the United States?
oh, absolutely. So these are things that I have never seen polio. My grandmother was the last person that I know, and she passed away a year ago at age 94. So we're really saying that there's very few people in the United States who've ever even experienced seeing this illness. We're not even able to pick up on these illnesses that we've never seen before. So what I see a lot with my patients is that if they don't see it, they don't believe it exists. But we're here to tell you today that polio exists, whooping cough exists. These things are here. And if you haven't been vaccinated on time, you're at high risk for getting these illnesses.
Dr. Brooks, let me just come back to you on trying to understand the work on health disparities that we've seen being so important. But what's the relationship between health disparities and whether or not our children are getting their routine immunizations?
So first, we are finding that there is a disparity, but the disparity is actually lessening, and that's a good thing. More with the younger children. It breaks out more with more disparity as the children get into young adulthood or adolescence and then young adulthood. So importantly, I think most importantly, the primary factor that affects your overall well-being are social determinants of health, not the health care that you are provided, not your genetics, but the environment in which you live. And so it reflects back into the immunization rates and into the overall care provided. So for example, if you don't have good transportation, if you don't have your own doctor where you can call, I want to talk to Dr. Brooks, not I want to talk to the doctor who is there. If your family cannot get off for work because they work 9 hours with no sick leave, these affect your access to health care. These affect the manner in which you can receive health care. So what we see is when these children are in this situation, they're less likely to get vaccinated. And that also leads to issues, as you kind of discussed. They end up showing up at school, they're not vaccinated. You might find that they don't have their free lunch program, so income is a part of it. All of these things reflect on your overall health. So as we monitor the immunization rates, and again, they're closer, but as they diverge, we see poorer health in general, not just with the vaccines.
Good. Well, thank you for that. And one last question of you, Dr. Ridley Jones. I want to understand that there's some people in our audience who are raising the question about monkeypox. Should we be concerned about monkeypox in our kids and adolescents? And is there a vaccine for them to take? And if so, should they?
So there is a vaccine available. Unfortunately, it's in limited quantity, but the quantity is being made available to the general population on a daily basis. We have clinics that are popping up all over. So monkeypox is highly contagious if you come into contact with lesions. And so it's not something that we need to sound the alarm on at this point with our school age children, but it's something we need to pay attention to closely because, as you know, when you're sitting in the classroom with children, they touch everything and they're constantly touching each other. And so just please pay attention to what's going on with monkeypox. The vaccine is not readily available if you have not had a high risk contact, but we should have it available more so in the next couple of months.
And may I add
Great.
something there, Dr.
Mhm.
Tuxton? So
Please.
there is a vaccine, Junios. It's indicated for 18 and up. The cases that we're seeing, we have 15,000 cases in the US thus far. Generally speaking, you get monkeypox from close contact. The cases we're seeing in LA County, where I work, 95% are MSMs, men having sex with men, sex workers, and those that are at high risk, like those who are taking PrEP, HIV. So right now, we don't need to worry about it. But why are we talking about it? We're talking about it because sooner or later we will need to worry about it. So we need to get on it now while we have a handle on it. So I'd say for the parents, you should be aware of it, understand, don't worry about it. Take care of the other stuff. It should be in the back of your mind. If you think that your 20-year-old is creeping out, not sure what's going on, maybe he needs to know about it. But we're okay for the time being,
Right. And most of the pediatric cases, we're seeing transmission in households, in families. So that's where our focus needs to be. But I agree with you, Dr. Brooks.
That's great. Well, thank you both for that. And we've got work to do. Let me turn to Dr. Otu. And Dr. Otu, as I mentioned in the introduction, and I was very specific about the fact of the impact of the loss of schooling on our kids. And too many of our children are now disproportionately pushed back in a number of ways because they weren't able to attend school. Well, we're now in the middle of the back to school season. And we notice that in almost every state, including the District of Columbia, there is a requirement that you are now up to date on your children's vaccine schedule, or they will not be let back in school. And so this becomes very important. But as I think in my mind, Dr. Otu, about why it is that we are having so much trouble getting our children consistent with the recommendations and the guidance for their vaccination shots, that a part of it, of course, is because of this plethora, this deluge of misinformation. Can you help us to understand about how important misinformation about vaccines has been and the chilling effect it's had on getting everyone compliant with what's been recommended?
Sure. Well, Dr. Tuckson, thank you for having me, and thank you for the work you've done with the Coalition Against COVID-19 in the Black community. And thank you to blackdoctor.org for all the work you're doing, to my distinguished panelists and to the partners and listeners today. You know, there is so much that we could talk about, but perhaps I'll focus on most recently the World Health Organization declaring misinformation as a public health emergency, which is staggering to think about. As an organization, we have spent the last few years ahead of this declaration by the WHO focused on disinformation and specifically around vaccination confidence. And when we, as a team, think about this, we think about it in three areas. You know, the role that social media can play in personalized engagement. The second is the work that we and partners are focused on in making sure that vaccination programs are resilient. And then the third is the focus on vaccination equity, ensuring that communities all around the world, very similar and aligned with the work that Dr. Brooks was outlining about social determinants of health. So making sure that we're focused on vaccination equity. Underpinning all of that is trust. And so as an organization, we've partnered with Facebook or Meta to make sure that we can understand the link and vaccination confidence. You've seen some recent action over the last few days where social media platforms are doing more and more to remove disinformation. Because here's the crux of the matter. Vaccination confidence has a very high correlation or link with health literacy. And when health literacy is low, as it is today in the Black and Latino community, then that impacts people's confidence in the information and then the likelihood to get vaccinated. And so we certainly understand the role that vaccine misinformation can have, especially in social media, which is why it's so important that we have community leaders, healthcare professionals articulating in words and language that makes sense, coming from community leaders that are familiar, that are well recognized and trusted, and that we are consistent. The same message from multiple partners, from parents, from healthcare professionals, from schools, from local government, all saying the same thing, again, in a way that people can understand.
Let me take this on head on then with you, Dr. Otu. There are, in addition to the relative literacy challenge that we have, because of course, so many of us have been subjected to substandard education compared to others in our country. And that's one of the social determinants that we continue to fight. But there have been deliberate preying upon our community by people who do not mean us well and certainly do not mean our children well, talking about and making a claim that routine childhood vaccination somehow will also lead to a disease or a condition called autism. Would you please set the record straight for everyone watching this show today about the relationship or lack thereof between routine childhood vaccinations and autism?
Sure, I'd be happy to. I think first and foremost, our governments around the world, academics, physicians all around the world and in this country have been very clear that there is no established link between autism and vaccinations. The genesis of this work has been linked to a gentleman who I hesitate to even raise this individual's name, but a physician that was practicing out of the UK, whose work has been discredited because there was no causal link. The publication where that work was published has been retracted. And again, no link has been established between autism and vaccination. Misinformation is not new. So as you noted, there are individuals and well-funded organizations who have been driving a lot of vaccine misinformation. And that is why it is so important, one, to call it out, two, to root it out, and three, to make sure that we are countering this with information that parents and providers can understand to help them make informed decisions about not only vaccination, but their overall health care.
I'm so glad that you made it clear. And again, I think the key part that I'm taking away from your answer is that the work that the purveyors of death and disease continue to try to promulgate onto the Black community is based on work that's been so thoroughly discredited, not only by physicians and scientists in the United States, but around the world. And yet there are still those who continue to continue to spread this misinformation and thereby putting our children at risk. And particularly, again, sitting in a classroom. I'm just trying to imagine what it must be like to have a child sitting in a classroom with other children who may not be caught up on their vaccinations and thereby putting my child at risk. It's just simply unfair. And I'm glad that you've cleared that up. We know that if we're going to get more children vaccinated as appropriate, we're going to need to have, in many cases, a team approach, particularly when you're living in an underserved communities. Earlier, our physician colleagues have really expressed how important it is to have those well-child visits. But in addition to those visits, when it comes to immunization, we've noticed pharmacies and pharmacists becoming also a provider of some primary care health services. From your vantage point, what are you seeing about the relationship between the pharmacy and as a source of not only providing the drug, but providing administration of vaccine drugs?
Thank you, Dr. Tuckson. As you know, I'm a pharmacist by training, so this is near and dear to my heart. 65 million Americans, 1 in 5, are living in areas, whether rural or urban, where access to healthcare is a challenge. We also know that most Americans live within 10 miles of a local pharmacy. You've seen over the last several years, but most recently in the last couple of years, a significant expansion in the role that pharmacists can play, given their proximity in the community. Pharmacists are typically always ranking in the top 1 or 3 most trusted professions in the nation and frankly in the world. Again, they're accessible. Most people are able to get to them based on work schedules and other circumstances that can impact, again, access to care. In 2009, just to set some context, about 28 of our 50 states enabled pharmacists to vaccinate. In 2020, following the federal PrEP Act and in response to the pandemic emergency, all 50 states have now enabled pharmacists to vaccinate, and specifically the ability to vaccinate children to as low as 3. Now, different pharmacists and different pharmacy chains can obviously make a choice as to how low they go in terms of vaccination of children. And typically we'll let the pediatricians handle the babies up to about, birth until 18 months. But in summary, the role of pharmacists has increased. I think that's a good thing. I think more and more people have access to pharmacists of the COVID vaccines that many in my family, including myself, have received. We received them from our local pharmacy as well. So I see it as a good sign, and it's a great opportunity for the vaccination across the life course, children, adolescents, and adults.
Dr. Brooks, let me come back to you for a moment on this point. And you work in an underserved community there in Watts, in Los Angeles. And I know that you probably are somebody who has a good view of making sure that even if we are using pharmacies as a place to get immunized, that should not cause people not to keep compliant with the well-child visits. Am I correct in that?
You are correct in a couple of things that Dr. Atu stated. Number one, parents are more likely to get their children vaccinated by a pediatrician. Number two, there was some pushback in the medical community worrying about kind of what we were discussing, that if the pharmacist is doing it, you're not going to visit the doctor. That has not been proven to be true. Number three, there are the 3 C's of vaccine hesitancy: vaccine complacency. Do I really need it? Vaccine confidence. Do I trust it? And the third one, though, is vaccine convenient. How convenient? How easy is it for me to get vaccinated? Pharmacists are fitting in that third niche. You go to the pharmacy sometimes, not even get medications, go to pick up some toothpaste or something. So you could literally go in to get some toothpaste and get vaccinated. I got my booster vaccine, both of them, at my local pharmacy. Yeah. So I think that we want that extra access because we often miss access as African Americans. But I'm not worried about losing the children to the pharmacists and not getting their well-child checks. It's not happening as of now.
I see, Dr. Riddle Jones, you're nodding your head as well. And I would imagine that you're celebrating having multiple comprehensive engagements that are linked together somehow. Am I reading your body language correctly?
You definitely are. There's having the pharmacist available to, so it's another trusted person. So in many of our communities, we're looking to get advice or to get our immunizations, medications from people we trust. And so there are lots of small pharmacies and even big box pharmacies where the pharmacist has been established there for years and has a relationship with our patients. So it's an opportunity. It's a welcome opportunity. And then also we have groups who are less likely to go in for well-child visits. So after a certain age, you only need to go to the doctor once a year. So going into the pharmacy and seeing availability for vaccines when you go to get a bag of chips for some of our teenagers, and if they're with their parents, of course you need consent in most states. It's just an opportunity. So it's welcomed. I love it.
So I think the take home here that I'm sort of, as I listen to our experts, it is okay. And if you can go get to your child immunized at a local pharmacy, terrific. But whatever you do, make sure you keep records of what you've experienced. Not every state's vaccine registry is working as it should. So make sure you know what has been done and you bring that information to your regularly scheduled, and you must have regularly scheduled well-child visits with your pediatrician. Bring that information there so that all the pieces of the system know the same information. And that's our responsibility as parents or caregivers of our children. And so let's make sure then that we are doing that. Well, one of the things that you used, Dr. Riddle Jones, and as well as Dr. Brooks, and that's the word trust and trustworthiness, about whether or not people will be willing to take these vaccines. So let me come back to you, Dr. Otu, and make sure that we're clear about the trustworthiness of the safety and effectiveness of the vaccines. We've talked a lot about the effectiveness of these vaccines, and the good news about the safety, again, about the effectiveness of them, again, is that they work. We know these are very effective if people take advantage of them. And we've already learned in the course of our discussion the dangers of what happens when we do not get our children vaccinated. But talk to us about the safety, Dr. Otu, and you are associated with a company that makes these, some of these important vaccines. What is the rigor of the process of your development and the approval process that ensures that these are in fact safe substances to give to our children?
Sure, I'd be happy to. So, as you noted, Merck has a deep and tremendous legacy in vaccines, 130 years of experience in vaccines. From a pediatric and adolescent perspective, we have vaccines against 11 infectious diseases. There are about 9 or 10 vaccines. Some of these are combination vaccines. And there's a tremendous amount of rigor that's involved in not only the research and development of these vaccines, the manufacture, all of the regulatory work. All of these vaccines need to be manufactured at a very high standard. We have to ensure informed consent, very rigorous clinical studies. We work with the FDA and other major regulatory bodies around the world. It is serious stuff, and it is based on the premise that vaccines are going into healthy individuals, healthy babies. There is nothing wrong with these babies, and we need to make sure that after they receive the vaccine, that is still the case. And so this is again very rigorous, very high standards across a range of areas and expertise. We have pharmacists, physicians, biostatisticians, manufacturing experts, many others ensuring the compliance of and safety and effectiveness of all of these vaccines.
And actually, I comment on that, Dr. Tuxson.
Yes, please, Dr. Brooks.
So this is really critical because the concept of the vaccine hesitancy and people worried about getting their children vaccinated, the confidence. So first of all, trust. The studies consistently show that mothers, families trust their doctor more than anyone, more than the internet, more than their cousin, more than the neighbor. So it's imperative that the providers, the doctors, and the advanced practice practitioners understand and have that trust. Number two, is imperative they understand how vaccines work and can believe it. I always say that parents can look at you and smell a rat. If you don't really know why influenza vaccine is safe or the COVID-19 vaccine is safe, they can sense it. And third, one thing that wasn't mentioned on my bio, I actually sit on the ACIP. I sit on the committee of 15 of the CDC that makes all the recommendations.
I'm sorry, Dr. Brooks, let me make sure that, so that's the Advisory Committee on Immunization Practices of the Centers for Disease Control.
Right. So I'm there when we make the decisions. Okay, it goes to the FDA. FDA says we approve it. Then it goes to the ACIP, says, how do we use it? FDA says we can use it. ACIP, yeah, let's use it. 2 doses, start with kids, 6 months, 5, whatever. So in those deliberations, they're tough. I mean, it's like if Merck is giving us something that's like, okay, well, that didn't make sense. We say at Merck, that didn't make sense. So, and we have to have be screened for conflict of interest. So there's no self-dealing. I would not recommend, I don't get anything for recommending the vaccine. Neither does Dr. Riddle Jones, Dr. Otu. Merck will do best as a company when the vaccine is perfect. So when you start to look at motivation, there is no motivation for, skipping on safety. We took J&J vaccine off the market when there was any concern about it. There was a rotavirus vaccine called RotaShield that was pulled and taken and done with. So I just want the public to know that safety is paramount and there's no reason to look any other way.
Deborah, I'm going to get you, Deborah Levine, I'm going to get you in on this conversation, but I want to make sure that as we deal with this issue of trust and distrust in the community, I know from many of the conversations that we've had on COVID vaccines that people were unaware that there were physicians and scientists of color who were involved in developing the drugs, who are on the committees. Dr. Brooks has given us a thumbnail sketch of the process, but it begins with external advisors to the FDA. There are physicians of color, including a person who's on our Black Coalition Against COVID leadership team, the president of the Meharry Medical College, who sits on that committee advocating for the best science and watching and making sure that people of color are protected, that he's got our back. We also then know that after those drugs have been approved by the FDA, they then have to be approved at the level of the CDC for how they're used. And now we are meeting face to face one of the people that is sitting on that committee, and there are others of color that are there. So we are under the tent, looking out for these issues. This is not just a white people deal. There are Black physicians at every level of this, which is important. But Deborah, as you are working in the community and at Harlem, so we've got Watts on one side of the country in the House, and now we've got Harlem on the other side of the House. How do you hear, and what are you hearing about some of these issues of concern around the trustworthiness of vaccines in general and childhood in particular?
So let me first say thank you very much for having me be a part of this conversation, and thank you all for the work that you do, providing support and education and care to our community as a whole. What I will tell you is that if vaccine conversations were hard before COVID, it has become a bit more difficult now to help community tease out science-based information amongst all of the sort of misinformation that's been floating around. The good news is that we still have community health workers and trusted entities like you all as physicians who come into the community, share in plain language what those vaccines are, why they're important. We're able to work with our community partners to create safe spaces. But I think when we hear the voices of our parents, of our community stakeholders, the concern is, has this been tested? What's going to be the long-term effects? And very honestly, has this been tested on Black people? And so when we are able to have these kinds of conversations and these kinds of shows where we're able to show people who are actually a part of that review process, this becomes extremely helpful in being able to address not only the disinformation, but also some of the stigma that may be attached to asking those kinds of questions.
Good. I'm going to come back to you for a minute, but let me go back over to Dr. Otu for a second and make sure that we are clear about this important point that has just been made. Dr. Otu, can we be confident and comfortable that people of color have been appropriately represented in the clinical trials and the research that underscores the process of approval of these vaccines?
So absolutely, across the industry, and there were a lot of lessons that we've learned through this pandemic. Obviously, there were issues prior to the pandemic. The pandemic really opened up our eyes to the importance of items that Dr. Brooks talked about, these disparities in care. So without question, across the industry, not just at Merck, but with other industry partners, we are doing everything we can to ensure that the clinical studies are representative of the national demographic. Now, there's more work we need to do, and it's with partners like blackdoctors.org. It's with community advocates. It's with folks who are focused on the community and behavioral science, like Dr. Levine has outlined. But all of this work is to make sure that the clinical trials are representative of the populations that make up the United States and other countries around the world.
Well, Deborah Levine, I'm so glad you raised this point. I mean, it's just extremely important. And one of the things that, although it's not the subject of today's conversation, but I'm sure with blackdoctor.org we'll be coming back to it. In fact, I know we'll be coming back to this in future shows, and that is the issue of getting more people of color willing to participate in the clinical trials. Because as you said, Deborah, the catch-22 is, have we been studied enough in Black folk? On the other hand, have Black folks been willing to be involved in the clinical trials for these studies. But the good news is, and the take home on it, Deborah, is that yes, we do have sufficient people of color in these clinical trials to prove that these drugs not only work well for our community, but are safe. Deborah, as we were talking earlier, Dr. Brooks sort of and others laid out these issues of these social determinants of health. Can you talk from your firsthand experience there in Harlem? What are some of the challenges that we are really facing when it comes to being able to make it easy for families to get their children vaccinated?
So I think there are several factors. I think health literacy is one of them. We work with our community-based organizations and associations not only to help them have science-based information about vaccine and vaccine uptake, but we also train community residents to educate other community residents about the importance. So again, it's using these trusted community constituents to be able to share the importance, and making available, also working with our FQHCs, places like Ryan Center, where they're opened on nights and weekends, where they
The
have
federally qualified health centers, is that what you're referring to?
Sorry, yes, federally qualified health centers who are open on nights and weekends, that make it more convenient for families to be able to access care. Being able to train community health workers and outreach workers in knowing where those locations are, and being able to share with them the sorts of information that was so helpful on that handout about when children should be immunized and where they should be able to go, not only to the primary care physicians, but if they aren't able to make that, being able to utilize local pharmacies where we're able to work with them to get those immunizations, but then also make those connections to their primary care physicians.
I wish I could have been a fly on the wall for some of these conversations when you are recruiting these community advocates. Give us an insight. Why would people volunteer or come forward to be engaged with their fellow neighbors, citizens in this effort? What's the stimulus and the motivation? What's on their mind?
So these are the same people who have been there through food insecurities. These are the same people who are the aunties and the uncles, and who are the light, sort of the light in our community, that when something goes wrong, these are our pastors in our houses of worship. These are the storefront folks who, when folks don't have food, have been giving food. These are these trusted entities, and they have been caring for the community and for us for as long as we've had community. And so before we can get them to you to receive care, there is a whole network of community members who are talking, engaging, encouraging, and even hand-holding people directly, making those appointments and walking them to those appointments. That is how we really begin to move the needle around creating those safe spaces to have those hard conversations.
You know, our experience in this country, and has been so well depicted by what you said. I remember from my work in Washington, D.C., early in my career, one of the great stalwarts of the community used to always say to us that no people but a people will save a people. And we've been alone a long time out there in this world fighting for survival. No people but a people will save a people. And we have been saving each other for a very long time. And we're just so blessed. I think we all sort of sometimes, are in danger of taking for granted the people who care so much about us. And what I really like about your observation, Deborah, is that you sort of answered it in the context of a combination of things. That there's not like you go do a immunization activity or a food activity or this activity. It's all of them together because our problems are so intermingled, aren't they?
That they are. I mean, we do everything from helping to write scripts, and we help to create PSAs, things for Facebook, Instagram, but we also create stagnant pieces of actual paper that can go into public housing and get put up in laundry rooms and get slipped under doors or shared at the community picnics. So it is all of us that it's going to take to be able to move this. It's not just you as physicians who are responsible, but it's us as a whole community. And the more we are able to educate and normalize and make this a part of everyday conversation about the importance of vaccines and lifetime vaccines and supporting our young children, the more critical that we'll be able to impact those numbers in our communities. One thing we know, we're not broken, but we definitely have the resources to be able to move this agenda.
Well, I'm going to ask you one more question, but I want to alert the panel that I'm going to come around to each one of you in a few minutes and ask you, based on everything that we've sort of been talking about, what do you want to sort of re-emphasize that you've either said or you want to talk some more about, or something that we have not touched on yet? So Dr. Brooks, you'll be first in that sequence, and I'll be coming to you in a moment, but I'm giving you fair warning that we're coming back. Deborah Levine, when I sort of think about, again, being a fly on the wall for some of these conversations, what are the hardest issues that you have to deal with to overcome a parent's reluctance to getting their child vaccinated? What are the tough things that make your job just more difficult?
I would say it's the misinformation, the health literacy, but really the misinformation. What people read on social media, what people hear, the inability to have science-based, culturally competent, linguistically sensitive information that our community can digest. That becomes the hard part. It is fighting against those sort of folklores and stories. But the good news is that we do combat it. We bring in physicians like yourselves. We bring in those community members. We bring in our parents who share their stories about the successes. And so every time we get one more parent to say yes, and we get one more vaccine in the arm, we get that much closer to getting our community to be that much more healthy.
You know, Deborah Levine, you are a breath of fresh air, I must say, and you're the only non-doctoral level person on this panel. But I think you can sort of see that you and what you represent is so key to whether or not we as a people will be maximally healthy or not, whether our children will be maximally protected or not. And I just have to tell you that we owe you and all those who are doing the work that you do all around this country a round of applause, a gratitude, a hug, something. But we take too often, we sort of take y'all for granted in this country. And I am on a personal crusade to applaud every one of you because you are so vital. So thank you for what you're doing. And you're getting the cue, so you get to think back as the last comment of the night of the program on what you didn't, either what you want to double down on or what you wish you had asked. But let me turn to Dr. Brooks. Are you going to double down or are you going to add something new?
I think I'm going to double down because I really appreciated hearing from Ms. Levine. The immunization rates wouldn't be where they are without her. You got a doctor, you got a past president of medical school, you have a pharmacist working in the industry, pediatricians. But if there's not that community link, especially for our people. So what I would close with, if that's in fact what I'm doing, is that again, vaccines are technological, medical, biological miracles. Now, as a parent, you always want to do what's best for your child. Every mother, father, auntie, grandma wants to do the best for their child. So when you're getting your child vaccinated, you're doing the best for your child. So feel very confident in that, feel proud that you're doing that, and then understand it links to the overall health and wellness of your child.
You know, Dr. Brooks, one of the things that we have talked about, you and I, one-on-one about, has been through our COVID experience, that there was a vaccine called an mRNA vaccine. That was one of the forms that was developed in what some people thought was record time, because it was, but that really caused some folks to be concerned about it. I always viewed it, Dr. Brooks, as one of the greatest achievements that modern man has achieved. How do you view that? And why do you think that there are those who seem unable to celebrate the genius of the human mind?
Yeah, so it was developed in part with a sister, Kizzy Corbett. A pandemic hit in around January of 2020. And by December of 2020, we had a vaccine on the market that was safe and effective. We've had 1 million deaths in this country. We'd probably have 3 to 4 times that many if it were not for that vaccine. That was that first Pfizer vaccine, followed by Moderna. It is beyond what everyone I could ever think when I went to medical school that they could develop an mRNA vaccine the way they did. Now, people didn't trust it because vaccines used to take 3 to 5 years to come to market, but the technology behind it had already been worked out 10 years ago by the NIH National Institute of Health. So I think it was all that misinformation, mistrust, a lot of politicizing of public health, which should never happen. Whether you're Republican or Democrat, you will die from COVID if you're not vaccinated, likely. So I think that we were in a weird space. I think about 2020 was a strange year. And people began, that mistrust with vaccines bled into COVID and multiplied. So that happened, but the bottom line, you got to look past all of that. And we as people have to say, I hear all that, but I'm getting vaccinated. I know. And it turns out Black people wear masks more than anyone else and are the most worried about COVID. So I think we have come up with some concept as a people that we truly do understand that we need to get more vaccines in our arms. But
good for you.
I think that that's what it was, that it just happened so fast. It just wasn't the norm. And then the other conditions were in place. But it's a medical technological miracle, and people should laud it. It's whoever developed it should get the Nobel Prize.
Thank you so much. And Dr. Riddle Jones, I think one of the things, whatever your comment will be, you get to make it. But one of the tag-ons to Dr. Brooks is that all that misinformation about how you're going to grow a third arm and a fourth eye and whatever else it was, none of that occurred. All that nonsense that people put out there that we had to fight through. And by the way, most people don't realize this, but we closed the disparities gap between white and Black immunization rates for COVID. First time we've ever closed a disparities gap. We did, and guess what? We did it. No people, but a people will save a people. What are your last words, Dr. Riddle Jones?
So speak up. So no matter where you are, if you have questions in your doctor's office, make sure that your questions are answered. If they're not answered appropriately, seek others to answer those questions. Yes. Look for credible resources. So I always recommend going to .org, cdc.org, your local health department. But if you have a question, you deserve to get that question answered. So keep speaking up. Keep asking, and don't be satisfied until you get an answer that satisfies or answers your question. That's my final word, definitely.
And by the way, I really think it's also very important around this reference to the CDC. We know the CDC has got challenges, and we know that even they have come out in the news and said that they're going to do some reorganizing to be better able to serve the public. But it would be a tragedy if our community misunderstood what the CDC does and the competence and capabilities of it. Their website is the place to go for information. And as soon as you finish with the CDC, you go to blackdoctor.org because they got a great website too.
Absolutely.
But you go to the CDC and take time to go through there. The work that is done there by the dedicated scientists who are the best in the world, who contribute either directly or indirectly to that work, that's the trusted source. And I would urge you, plead with people, make use of it. It's your tax dollars that fund it. Take advantage. So I'm glad, Dr. Riddle Jones, you made that comment. Well, Dr. Otu, what is your, are you doubling down or are you adding a new one?
I'm gonna do a little bit of both. So we have seen so much ingenuity following the impact of COVID-19. You've all talked about the increase in vaccination rates, the closing of disparities. We've come a long way with pediatrics, but we still have a gap with the adolescents. If we look at the rates between 9 and 16-year-olds, the vaccination rates are still very low. So I would ask, let's take a village approach. We still have work to do. Let's get as many of our adolescents vaccinated as possible, especially as we head back to school. We can do this. And I'm very confident that if we work together, we can accomplish it.
That's very important. You mentioned adolescents, by the way, and let me go back real quick to Dr. Riddle Jones. There's one disease that has a vaccine that we didn't talk about, but is very relevant to adolescents, and that's HPV. Dr. Riddle Jones, can you just give us a quick update on what I mean when I say HPV?
So HPV, thank you so much. So HPV is human papilloma virus, and it is preventable, and it is something that any gender identity, any sexual orientation, anyone is at risk for it. We used to focus on the vaccine, giving it to children, but now it's available up until age 45. So if you have not been vaccinated, please get vaccinated. But it is leading to not only cervical cancer, but also anal rectal cancer. And the one that is shocking all of us is oral cancer. So all the oral cancers, not all, but the majority, about 80% or more that we're seeing, tongue, inside the mouth, those are HPV related cancers. So we actually have a vaccine that can prevent cancer. So I push it all the time, and I just recommend it for everyone.
So without being too graphic for our audience, I don't think it takes a lot of imagination to figure out what Dr. Riddle Jones is talking about here. And so there are sexual acts that will cause a very intimacy of that virus being introduced into the oral cavity of a human being. And years later, we're seeing that now with an increase in esophageal cancers and cancers in that area. And so what we're saying is, parents, regardless of whether you're squeamish about this, you can protect your child, especially when your child is no longer a child. But doing the right thing today prevents a problem for your child down the road. This is just good parenting. And so be attentive to this HPV thing. Well, Deborah Levine, are you going to double down or are you going to add something new?
Going to double down. I'm going to encourage you to please make it a family event. Take all of the family members and go and get vaccinated. Stay up to date. Keep those records. And if you need help, ask for it. Reach out. Talk to folks, get the answers you need.
Beautiful. Well, I want to thank this outstanding panel for their contributions today. Each one of you have added so much to the conversation, and I love this last point that that you raised, Deborah, because it's this idea of it's a family affair and it's a community affair, that we can do this together. Saving Black life is something that all of us should be committed to. We've come too far. Our bondage in the belly of ships, transacting the ocean, living through slavery, living through Jim Crow, living through all the challenges that they throw at us every day, even today. We have still struggled to survive, to fight for life. And above all, we as a Black community ought to be very, very proud of the fighting that we have done to protect our children so that they can have a better life than even we have had. This is our legacy, it's our historical duty, and it's our responsibility. We work together. And so this is a family affair, it's a community affair, and we're all working together. I want to make sure that we are very, very focused on our children getting back to school. It would be a tragedy to come out of COVID having had our children lose the opportunity to be in school, losing the socialization, falling farther behind on educational achievement, and falling behind on nutritional status, because so many of our kids require the nutritional services of schools to have a healthy childhood. It would be a shame for all that to be lost because a child does not have up-to-date immunization record and cannot prove that they have in fact had their immunization up to date. So we need to get everybody out there now before school starts. Get out there, get your child vaccinated. Much more important than getting a new pair of tennis shoes. After all, what's more important than protecting our children? Have a good day, everyone. Thanks to the panel. Take care.
Thank you.